Hi, my name is Jennifer Shepard, and I am licensed as a physical therapist and have specialized in many advanced modalities within physical therapy, in and out. I am a fellow of the American Academy of Orthopedic Manual Physical Therapists, and I have a significant training and mentorship in visceral, vascular, and neural manipulation through the Brawl Institute. I also incorporate many components and concepts from Stephen Porges' polyvagal theory, and I'm also developing kind of our own theory through integrative manual physical therapy, which is the trauma compensation theory. So all of these together, as we look at, here is a patient right now at this particular stage in disease or degeneration or symptoms, and so much of what our medical communities are focused on are the symptoms. And where we ask bigger questions, we dive into, here are these symptoms. What is the body trying to tell us? What does the body need? And as we look at the body through all systems, we look at the fascial systems, the musculoskeletal systems, we look at the nervous system, we look at the autonomic nervous system, we look at the digestive system, vascular, we look at all systems because that's how we're created. And the body is brilliant as things happen to it throughout a lifetime, and this is where trauma compensation theory comes in, but everything that happens to you, it can change the structure of the fascia, it can change the structure of the tissues, and as I say tissue, it is fascia, it is tissues that comprise your organs, even the tissues that comprise your vascularity. So anytime, and so much work and research in the fascial world really supports this concept of things get stuck in the body. So trauma happens, something gets stuck, and when you think about if tissues get stuck and they don't have the ability to slide or glide, how does the body compensate to keep you walking, keep you moving? If tissues are stuck and fluids can't get in or out well, or again, back to vascularity, if there's some compromise on a tube, how well is the fluids, how well are fluids going in and out of an organ or tissue? So we look at the entirety of you. What's everything that's happened to you throughout your lifetime? A lot of things you remember, a lot of things you won't remember. And then we start to unpack what we find on the table. So the other very important pieces, our hands are tools, and what our hands are able to find, discern, and unpack. Often many things that don't show up on other testings or MRIs. It is really fascinating, the things that we will identify with our hands, and then someone goes in for an ultrasound and it's confirmed. So again, the ability for a trained hand to feel, often I say I'm the princess in the pea. So you have 10 pillows, there's the pea. The training that I've had and the sensitivity in my hand, I'm able to feel down to that level and tell you all about the pea that's down there. So our hands can feel areas in the body that don't have as good of fluid dynamics. We can feel in the body where the nerves aren't quite conducting, the pathways aren't as clear as they need to be. We can feel areas in the tissue that just are a little bit more rigid. They don't have the viscoelasticity that they need. So where we are just beginning, it's so exciting to pioneer this work into brain, and again, as an entirety, because there is more to you than just your brain and how all systems relate. I want to share a case study. I had a new patient come in, and she came in with the diagnosis of Parkinson's, and probably in her late 60s, and has been through many neurologists through both of the big systems, and has really struggled with medication, and each new medication she'd try would tend to make her tremors worse. So I said, let's give it a whirl and let's see what we find. So as I worked with this patient, she has significant history of esophageal cancer. Her entire esophagus was removed, a lot of scarring. On the very first visit though, actually we did start to work in the brain, and it was very exciting. And as we go into the brain, we think about fluid dynamics, we think about the ventricles, we think about pressure systems in and out. Can fluids get in adequately? Can fluids drain adequately? Again, if jugular vein, which comes out through here, if there's something back up of jugular vein, or even going down into liver, into portal vein, if there's some backup or some pressure imbalances that, and I would say let's ask the questions, can that change the dynamics of the brain? If another very, very important aspect in the world of glial cells and lymphatics, brand new science coming out in that area, but the cleansing system that the cerebral spinal fluid does in the brain and the spinal cord, and the glial cells that are just that very, very first level of the brain as we go into the brain, into the pia, into the arachnoid, into the dura. So coming back to that, how well is that cleansing system working for a particular patient? Again, at night when we sleep, again, sleep is very important, we address that, but that's when all the so many metabolic processes, and that's when the brain is cleansing, it's cleansing toxins from all of the work it did during the day. Same thing with the spinal cord. So the cerebral spinal fluid always needs to be flowing in and out through the brain. It needs to be formed, flowing, cleansing, and then that starts to drain into the venous system and then back into the return. So again, all of these processes need to be as efficient as possible. So that is where, has there been a head trauma that's changed the ability for the cerebral spinal fluid to flow? Back to impact to the cranium or elsewhere. Is there something that's caused a tug on the dura? So as we talk about the dura covering of brain and spinal cord, and I don't have the brain here, but as we get into the falx, so these are membranes in the brain, the dura covers the cerebrum, and then becomes into the covering of the spinal cord. Again, 3 layers of the dura. But if there's any tension from old trauma, is there tension on the cord? Anytime there's tension, how well is that brain going to function when there is actual mechanical tension on the tissue or the dura? So another area we look at in the brain, again, is the viscoelasticity. And again, our hands can feel areas of the brain that just don't quite have adequate fluid dynamics, adequate blood flow. There's been trauma here. And the beautiful thing is our hands can feel that, identify that, and then start to restore. We start to restore the efficient fluid dynamics, restore healthy viscoelasticity of the tissue, which is all important for brain functioning, for the vascularity, the communication. So that in essence is the work. We identify where in the body, where do we need to begin. Another area we tend to go is the autonomic nervous system, that balance of sympathetic, parasympathetic. So again, for this patient who we started to work with, I've seen her about 5 sessions, and the very first session, again, she was in constant tremor on the table. As I came into the cranium and came in from an anterior posterior direction, came in and brought some compression into the system. My suspicion was coming into the ventricle initially. And as I came in and really was able to engage at depth, her body was able to just calm down a little bit, which was really, really beautiful. As soon as I popped off of that, things would rev up a little bit. So it was just fascinating as we were able to go in and go out. So the other big finding I found, again, I mentioned earlier, significant surgery. Huge surgery on her body. And we think about the scar tissue, we think about the impact of the fascia, esophageal replacement. And what I had felt as I was in her cranium was a significant pull on the spinal cord further down. So again, thinking about how well is the brain going to function when there is a mechanical pull through the dura, through the spinal cord, all the way up into hindbrain, brainstem, into hindbrain, into the brain itself. So those were some very, very significant factors. As I mentioned, jugular vein involved, vagus nerve. So again, so much trauma that happened through here, causing tensions. And back to where I can't help but wonder how well is the health of the brain if we're not getting adequate communication in and out, adequate fluid dynamics, and if the body is always in a constant state of protection and, if you will, trauma still from that surgery that was 11 years ago. So that is where I feel the work is very exciting. It is very unique for each individual person. So everything that happens to you is significant in your body. Structural, functional, emotional, all leaves a mark, and your body will always try to find a way to adapt. And what happens is when there's been trauma, adaptation, eventually, often, a body will come to the point where it no longer has opportunities to adapt. And that's when we start to see, we tip into disease, we tip into degeneration. So I find every patient fascinating. Let's see what we find. Let's look at the health of the brain itself, health of the nervous system. Are there any other players? Liver, digestive system, surgeries down in the pelvis, pressure systems. Who are the other players that contribute to lack of health in the brain? So we just continue to ask questions. We have nothing to lose to explore by asking questions and restoring health of a system, taking strain off the system. So we look forward to exploring this work more, to see what we can do to improve quality of life for so many patients who are starting to run out of options for medications or surgeries, and or are looking for just how can we improve quality of life as we deal with progressive degeneration. I am here on the west side of Cleveland. I delight in questions and conversations and dialogue, and we continue to work on how we bring this work to the research through case studies, research to support all of the aspects of what we do in the clinic. We truly believe in what we do, and we feel it's a very, very important missing link that is in today's healthcare. Thank you.